We change patients' lives on a daily basis just by showing up. When they feel heard, they're more willing to show up themselves for their health. They know that they have a teammate in their health, so they're going to put in the work too. My name is Marnie, and I'm a nurse practitioner with Goodness Health Group. I've been with Goodness for almost 3 years now. So what I've seen over these last almost 3 years, because they've been failed in the past, they felt unheard, looked over. Now they can sit easy during the visit and know, okay, I don't have to rush through this visit. I can see you tomorrow too if I wanted to. And so they're eager. They're right there on time, getting on their visit. They're ready to share what they've done that week. If we've set a goal and they've accomplished that, then we celebrate those wins. So Goodness Health Group is virtual. We're all virtual. We're not in a clinic setting. We have a frequency model, and we're taking care and monitoring their acute needs right from the start. So we're working really close with them, monitoring them, educating them through that process. And then after that, once that's settled, then we're looking at the person as a whole, from mental health down to some personal things. Maybe it's a housing need. We're able to spend that time with them and help them through that, finding those resources. Because it's not just taking care of a patient, it's caring for that human being. There's one story that stands out to me. This patient came to us. As I got to know him, I found out that his mom passed away, and she was his anchor. Any question he had, he would go to her. And after a couple of visits, after we built that trust, he asked me to be that person for him. And that's a heavy load. I was right there with him. That consistency, put him at ease. I got to care for him for 1.5 years, almost 2 years. He had a hard time taking care of his own needs, his personal needs, right? We got him meals on a daily basis. He struggled with alcohol throughout his whole life. He was one that was going to be lost in the system very, very easily because he did not have any support. He was my constant as I was his constant. I got to know who he was. So as soon as I would log on, I knew immediately that he was in pain without him having to say so. That's really powerful for someone who doesn't have anyone. I was his anchor in that. I was his voice. In the last few weeks of his life, it was me and a life coach that he had that we set him up with. And I let him know that I was not going to leave his side. I was always going to be there. I would call him every single day in those last moments. Unfortunately, he did live pretty far away from me, but just having me there, having the life skills coach there in those last moments, even though he was not vocal at that time, I knew that he could hear me. And that was really important, just to have those people around that he knew he trusted. And I'm glad I was able to be there for him, to comfort him, because that's what it's all about. Goodness is a really good example of how we're able to provide patient relationships, and his story is a really, really good example of that. We all have an end at some point, but I think what's the most valuable thing is that relationship and knowing that you have someone that cares about your overall health, your goals, what's most important to you. And it goes much deeper than just being a provider there for them on a weekly basis. It's not about just how can we get you as healthy as we can, but how can we get you as happy as we can. I love Goodness.